It is generally accepted that opioid use disorders are disproportionately prevalent in the LGBTQ+ population. This is an area where data is beginning to emerge as it has become a priority for many health authorities to research and address this. Although data is limited, I will share with you what we do know about substance misuse in this community and the answer to the knowledge check question. It's either A or B depending on which data you review, so it's 2 or 3 times more likely to misuse prescription opioids if you're part of the LGBTQ+ population compared to the general population. In a Minnesota student survey, it was found that individuals identifying as gay, lesbian, bisexual, or questioning demonstrated greater incidence of prescription misuse over the past 30 days compared to those who identified as heterosexual. LGBTQ+ students in the survey were up to 3 times more likely to report prescription drug misuse. Across all age brackets, those who identify as LGBTQ are said to be statistically more likely to misuse opioids and are 3 times more likely to develop opioid use disorder. In a study of high-risk prescription drug misusers in New York and Los Angeles, LGBTQ young adults were found to be twice as likely to be active drug users compared to other high-risk young adults. LGBTQ plus high-risk young adults were found to disclose more recent opioid misuse, and this study was focusing on homeless polydrug users and IV drug users. Misuse was defined as taking a prescription drug when they were not prescribed to you for you, or that you took it only for the feeling or experience that it caused. So among the most high-risk youth, the LGBTQ plus population was twice as likely to be intensive misusers. So this is knowledge check question number 2. Which age group reports the greatest misuse of prescription opioids? Either A, 18 to 25 years of age, or B, 26 years and over. The answer is A. Individuals 18 to 25 years reported greater misuse of prescription opioids in this survey. This data comes from the 2015 National Survey on Drug Use and Health in America. As you can see, across all age brackets, there was a greater percent of opioid misuse among minorities, sexual minorities, and that included lesbian, gay, and bisexual in this study. As you can see, across all age brackets, there was a greater percent of opioid misuse in that population. Misuse was more frequently reported in sexual minority men and women compared to the sexual majority. Prescription pain reliever misuse was greatest in younger adults age 18 to 25, and when all ages are considered, the misuse of prescription pain relievers was more than twice as frequent in the sexual minority population. And you can see that on the first column there. In the midst of an opioid epidemic, it's clear that lesbian, gay, and bisexual people are disproportionately affected. This 2015 data suggests that 1 in 10 lesbian, gay, and bisexual people had misused prescription pain relievers. In this study of British Columbia high school students aged 13 to 19, it was found that lesbian, gay, and bisexual students were more likely than their straight peers to report misusing many substances, including GHB, ketamine, LSD, methamphetamines, cocaine, ecstasy, mushrooms, tobacco, cannabis, and alcohol. Apart from this study, there remains a lack of data on substance use in lesbian, gay, and bisexual youth, and there is even less data on trans youth and substance use. There is some evidence that bisexual youth report the highest rates of substance misuse among their peers. This study of youth aged 12 to 19 in British Columbia high schools found the highest rates of substance use among bisexual students. All sexual minority groups identified in the study outpaced the sexual majority population in substance misuse. Lesbian, gay, and bisexual students in this study reported using substances to lessen anxiety about having sex. Lesbian, gay, and bisexual students reported using substances to cope with other stressful experiences and reported far higher rates of physical and sexual abuse compared to their sexual majority peers. We currently have no data on bisexual and lesbian women substance use from Canada. We do have some data from US and Australia that have shown the highest rates of substance misuse in bisexual women, followed by lesbian women. A US study of about 1,300 lesbian and bisexual women found that victimization and internalized homophobia increased the odds of substance use. A connection has been identified between childhood abuse, intimate partner violence, and non-partner violence with substance use among bisexual women. Data from the US and Australia indicate that cannabis use is particularly significant in bisexual women. Cannabis use in lesbian women is unclear, as some studies have found elevated use compared to the sexual majority women, and some studies found the opposite. In a 2015 National American study, it was found that women who identified as bisexual were twice as likely to misuse opioids compared to the sexual majority. Data from Canada and the US show high rates of drug use among bisexual and gay men. Many studies combined gay and bisexual men, so differences between the two groups could not be identified. Canadian data tends to be very Toronto-centric and may not apply across the country. One study of 612 gay and bisexual men in Toronto, ages 14 to 72, that 32% of gay men and 45% of bisexual men reported using illicit drugs in the past month. A 2004 study of Toronto gay and bisexual men was found that they would implement their own harm reduction strategies to reduce the risk while using substances. Strategies included being careful about the type, the quality, and quantity of drug consumed. They also reported avoiding mixing certain substances and also using a buddy system for safety. There's additional harm reduction strategies that pharmacists can support, and we'll discuss that later on. There was previously no Canadian data on substance use by trans people until the Trans Pulse survey was conducted in Ontario. The study identified a greater prevalence of cocaine and amphetamine use amongst transgender people compared to the general population. An estimated 12.3% of trans Ontarians had used at least one higher-risk drug in the past year. Higher-risk drugs included cocaine, amphetamines, and opiates. Misuse of prescription opioids was reported by 6.2% in the Trans Pulse survey, which is thought to be approximately 3 times greater than in the cisgender population, which is estimated at around 2%. Drug misuse in the trans population was associated with urban residents, childhood abuse, transphobic violence, homelessness or underhousing, and sex work. Although this data is older, from 1999, the data from San Francisco mirrors Canada in that trans people were found to have higher rates of cocaine and amphetamine misuse. There was also a high rate of cannabis use. One study of the U.S. trans women, it was found 64% of trans women and 43% of trans men had used marijuana in the last 6 months, had used cannabis. Injection drug use among trans people may differ by gender. In a U.S. study, 34% of trans women reported having injected drugs, most commonly cocaine, heroin, or speed, and 18% reported doing so within the last 6 months. It was found trans men, the rates of injection drug use were lower, at around 18% having ever injected drugs, and only 4% within the last 6 months. With injection drug use comes a greater risk of contracting bloodborne illnesses, as needle sharing was commonly reported in the study. This is another harm reduction opportunity for pharmacy in ensuring patients have clean needles and are not reusing. A U.S. study with 45 trans men and 45 trans women patients raised concerns that substance use treatment programs may not be safe spaces for trans people. In the study, trans people reported high rates of substance abuse while undergoing treatment, including being verbally abused by staff. In residential treatment programs, trans people face being categorized by their assigned sex at birth rather than their lived gender. It has been found that transphobia may limit trans people from accessing or maintaining treatment for substance use disorders. Although this data is older, from 1999, the data A U.S. study with 45 trans men and 45 trans women patients raised concerns that substance use treatment programs may not be safe spaces for trans people. In the study, trans people reported high rates of substance abuse while undergoing treatment, including being verbally abused by staff. In residential treatment programs, trans people face being categorized by their assigned sex at birth rather than their lived gender. It has been found that transphobia may limit trans people from accessing or maintaining treatment for substance use disorders. Transphobia may prevent trans people from accessing or staying in treatment altogether. I recognize this data may not transfer directly to pharmacy, but it helps us understand the experience of trans people seeking help for substance use disorders. At times they may have confronted difficult situations where they may have been mistreated or discriminated against. We need to be mindful of our role in creating welcoming pharmacy experiences free of abuse and harmful policies. At this point in the presentation, I'm going to switch gears, and now we're going to talk about medical use of opioids among sexual minorities. So this is with valid medical prescriptions and as opposed to misuse. This is knowledge check question number 3. In a Massachusetts survey, 35% of sexual majority respondents between 35 to 44 years of age reported ever being prescribed an opiate by a medical professional. What percent of sexual and gender minority respondents reported the same? So our options are A, 12%, B, 34%, C, 46%, or D, 58%. And the answer is D, 58% of sexual and gender minority respondents between ages 35 to 44 ever reported being prescribed an opiate by a medical professional, and that was compared to just 35% of their sexual and gender majority counterparts. In medical settings, LGBTQ plus people are exposed to opioids at disproportionate rates. From the knowledge check question, we know that 58% of sexual and gender minority respondents between 35 to 44 years of age report ever being prescribed an opiate by a medical professional, compared with just 35% of their sexual and gender majority counterparts. Certain clinical situations expose LGBTQ people to an increased risk of medical opioid exposure. While not all transgender people pursue surgical methods for gender affirmation surgery is on the rise. An opioid prescription is by far the most common form of post-surgical pain management. Opioid dependence is correlated with frequency of opioid exposure. Each of these procedures places transgender patients at increased risk of developing opioid dependence. It is also known that both transgender people and older people living with HIV have increased prevalence of chronic pain. Up to 1 in 5 of these patients report taking an opioid for chronic pain management. This information suggests that certain subpopulations of the LGBTQ community are at increased risk of developing opioid use disorder, and care must be taken in issuing them opioids. Another concern with opioid misuse in the LGBTQ plus population is a relationship exists between misuse and sexual risk, which leads to an increased risk of HIV transmission, as well as other sexually transmitted infections and bloodborne viruses. A number of studies have determined that opioid misuse may increase high-risk sexual and injection drug behaviors. The non-medical use of opioids among men who have sex with men, that's MSM, is thought to impair decision-making and is associated with an increased risk of condomless sexual intercourse, increased number of sexual partners, and sharing syringes. Additionally, opioid use may compromise obtaining and giving sexual consent and could be associated with sexual assault. It's also found that substance use is associated with needle sharing for hormone injection therapies. With regard to consequences, research has focused on the increased risk of sexual transmitted infections and bloodborne viruses such as HIV, where there are high-risk sexual behaviors concurrent with substance misuse, such as unprotected anal intercourse, many sexual partners, or needle sharing. The use of drugs in high-risk sexual contexts, sometimes referred to as chemsex, in the UK, chemsex is thought to contribute to rates of HIV and hepatitis C virus among men who have sex with men. Transgender people are thought to be at risk of acquiring HIV by needle sharing for hormone therapy injection. It is found that when LGBTQ+ individuals enter treatment for opioid use disorder, that there is a decrease in certain high-risk sexual and injection drug behaviors and an increase in condom use. This data is in support of creating treatment programs designed to address the unique risks of LGBTQ+ populations. Opioid use disorder treatment programs can provide interventions that guide sexual decisions during drug use, potentially reducing harms. Most of the data on opioid use disorder and sexual risk comes from gay men and other men who have sex with men, but there is little research on lesbian and bisexual women at this time. One way healthcare providers in general and pharmacists specifically can support the LGBTQ+ community is through harm reduction initiatives. The definition of harm reduction from the Center for Addiction and Mental Health describes an approach that tries to reduce the harmful effects of substance use. It can also be applied to gambling, high-risk sexual behaviors, and other activities that may be harmful. As we discussed previously, LGBTQ+ people are disproportionately affected by substance use disorders, including opioid use disorder, and some may demonstrate high-risk sexual behaviors that can be lessened by a harm reduction approach. A harm reduction approach involves working with the person using substances so that they use more safely without requiring them to stop. Some individuals may not be able to stop, be ready to stop, or want to stop misusing substances. When considering sexual health, harm reduction may be minimizing harms associated with unprotected sex, such as acquiring STIs including HIV and hepatitis C, through education and sexual health programs. A second definition of harm reduction from the Canadian Mental Health Association speaks to a client-centered approach to reduce the harms associated with addiction and substance use without needing individuals to abstain or stop substance use. This definition conveys a collaboration with individuals and providing choices with a non-judgmental and non-coercive strategy. Harm reduction takes a non-judgmental approach that supports people in making decisions about